a few stories as well, because the last couple of days I heard from Ken, who's Malheur County and is a former cancer patient. He has had a Blue Cross policy before Obamacare. He's since seen his premiums go up from $400 a month to $1,200 a month. Even worse, he writes, his deductible rose from $1,000 to $10,000. $10,000. Darren in Sherman County, a farmer, wrote me last month and said, I've been with Blue Cross for 31 years and have been happy for the most part. The premium covers myself, my wife, and my college-age daughter. We carried a $10,000 deductible up until November 23rd of 2015. Then the ACA kicked in, and the highest deductible we could obtain was $7,500, which we carry today. Unless we meet the deductible, the premium went from $3,516 a year to $16,242 a year, a net increase of $12,726 per year. Premium increase. 462% increase in 2 years' time for basically the same insurance. And then there's about 500 exclamation points. Point is, this individual market is in dire straits, and people can't afford what the government is forcing them to buy. When the president said, President Obama said, when we're done, families will see their insurance premiums go down $2,500 per family. $2,500 in premiums. Promise not kept. Said you can keep your doctor. Promise not kept. You can keep your insurance plan if you like it. Promise not kept. Now, we have great compassion for making sure people, especially in our rural areas, have access to affordable health care. It's something I've worked on my entire time in public office. It is extraordinarily important. And I'm sympathetic, and I appreciate the tone and tenor of my colleague from Vermont, because we share these stories, because we share these people, because we're trying to get to the right place for the right reasons. Both sides of the aisle are. We care about people too. And that's why we're not going back to the days of banning you from getting insurance because you have a pre-existing condition. That's why we're not going to go back to the days of lifetime caps, and why we're not going to go back to where kids can't be on your insurance policy. We're sticking with those. Can we all agree to that? That's what we're doing. We also are trying to address one of the flaws in the insurance market, where people could pay for 9 months of coverage and get 12. And the insurance companies are only on the hook for the first month of that 3 that somebody was covered, and then the providers were on the hook for the next 2. And with guarantee issue, you could start the whole process over at the end of the year. So as we looked at what are the changes we could make that would fix this market or help fix it, this is one of them: continuous coverage. By the way, it's what happens pretty close in Medicare Part D, Medicare Part B, and in the large employer market. We're patterning after what already exists in law. And the 30% premium penalty is because you didn't buy it till you needed it. You get a 63-day window. That's in the existing law. We patterned it after that. But you know, it's like you can't buy fire insurance for your house once the roof's burning either. Health insurance is different. We acknowledge that. We fully understand that. That's why we're not going back to the days of ban because you had a pre-existing condition. We're not going to go back to all these other issues. We want to make sure people are covered and cared for too. I appreciate the indulgence of the committee. I've gone over my time. I'm actually done, but if you've got, I'm past my time. But if there's somebody on your side that would yield, I'd be happy to enter into a discussion with you. Are there other members that seek recognition? The gentleman from Iowa is recognized, and the gentlelady is recognized.